When you schedule a knee replacement, you fixate on the operating table, but the real test begins the moment you walk through your front door. For the first 6 weeks, your new joint needs time to heal. Your leg will be swollen, stiff, and vulnerable to the physical layout of your house. A single slip or fall during this early recovery window can damage the new joint, leading to injuries that set your progress by months. The problem is, many patients don't find out what the hospital provides for free and what they need to buy themselves until they are already home and struggling to move. Let's map out how timing impacts recovery. Waiting until after surgery to source mobility aids drops you in the high-stress zone, relying on others while in pain. But acquiring equipment before surgery shifts the outcome, directly ensuring a smoother, independent recovery. Preparation eliminates that initial panic. Today, we are going to build your exact personalized recovery toolkit. This definitive guide is sourced directly from the Best of Health, the UK's trusted resource for over 50s navigating NHS and private healthcare decisions. Relying solely on a brief hospital discharge procedure is a gamble. Securing equipment in advance ensures you aren't fighting your own furniture while your leg is weakest. Let's start with the foundation: walking aids. These tools handle the structural support of your body weight while your leg heals. For the first 1 to 2 weeks, you will likely need a Zimmer frame. It provides the maximum stability required to walk short distances at home safely. The NHS reliably provides this frame, along with elbow crutches, at no cost before they discharge you. But here is the trade-off. While the NHS ensures you have the support to stay upright, standard hospital provisions offer no help for managing your swelling and pain. Managing that swelling is what actually speeds up your healing. Icing your knee regularly reduces pain, and most patients start with standard reusable gel ice packs. The difficulty with basic gel packs is that they warm up fast. This requires frequent trips back and forth to the freezer, at a time when your mobility is heavily restricted. This chart compares standard NHS provisions against out-of-pocket upgrades. On the right, we find a more efficient alternative for pain management: the cold therapy machine. This machine circulates chilled water around your knee through a wrap, providing consistent cooling. These machines cost between £80 and £200 to buy, or £30 to £50 a week to rent. They are not provided by the NHS. While the NHS provides the basic foundation to keep you upright, actively reducing pain and swelling requires a private investment in your own recovery tools. Next, we have to look at the bathroom. Wet surfaces and deep knee bends create the highest risks for a fall at home. Sitting on a standard toilet often forces you to bend a stiff knee cast a safe angle. A raised toilet seat adds several inches of height, making it much easier to stand up without strain. Similarly, a shower stool allows you to sit while washing, removing the danger of standing on a slippery surface with compromised balance. Some NHS trusts do loan out these items. However, waiting on an occupational therapist assessment can cause delays that leave you without support during your first few days home. Smaller items like long-handled reachers, specialized shoe horns, and sock aids help you maintain your independence without bending your knee excessively. They let you manage basic tasks without relying on a caregiver. The Best of Health research team compiled current NHS provision data and the 2026 UK pricing checklist for these specific aids. If you choose to acquire the full out-of-pocket upgrade list privately, you should budget approximately £250 to £500 total. If you are having your surgery done privately, remember, your hospital will provide the advice, but they typically will not loan you the equipment to take home. Purchasing your bathroom and daily living aids privately removes the uncertainty of NHS wait times, allowing you to maintain your independence from the moment you return home. It's important to remember that these aids are temporary. They are tools designed to get you back to normal life. This timeline maps your typical progression back to independence. In Phase 1, the first 2 weeks, you will rely on the walking frame for the most support, while the surgical site is fresh. During Phase 2, from weeks 2 to 6, you move to elbow crutches. This is also your most critical window for managing swelling. In Phase 3, you move to a single walking stick to build balance before eventually returning to walking unaided. Do not rush this timeline. Abandoning your aids too early significantly increases your risk of a fall that could damage the new joint. For a budget-conscious approach, use the free NHS frame and crutches, but buy a basic toilet seat and shower stool from a pharmacy or charity scheme. For maximum comfort, invest the £500 in a cold therapy machine and professionally fitted grab rails to make your daily routine as effortless as possible. Preparation is the best way to manage your pain. For more detailed guides and to access the full mobility aid checklist, visit The Best of Health at thebestofhealth.co.uk. Your recovery starts with the environment you prepare today, ensuring you can move through your home safely and confidently tomorrow.